One important principle of radiation therapy is that the tumor or the cancer should get the highest dose of radiation possible, but at the same time, the normal tissues or the surrounding healthy tissues should get the minimal dose or should get no dose of radiation. So, now how do we achieve it? It can be achieved mainly by two methods. So, one is a simpler method in which the patient positioning has to be suitable. Suppose we are treating, say, left side of the neck or left side of the chest. We ask the patient to look towards the right and keep his hands and limbs away from the radiation field. By doing so, those areas will get minimum radiation or no radiation. More importantly, how to prevent excessive dose to the normal structures is by choosing the best possible radiation technique. If we see in olden days, only 2D or 3D technique was available, in which, along with the tumor, a large area of normal tissues also used to get radiated. So, because of that, there used to be relatively more side effects. But in the present era, with advanced techniques like IMRT, VMAT, stereotactic radiosurgery, tomotherapy, etc., we are able to avoid a maximum dose to the healthy tissue. So, how is it done? Is whenever we plan for radiation, we initially do a planning CT. So, in that CT, we decide, okay, where is the tumor, where is the normal tissue, where are the healthy tissues surrounding, is there any critical organ like spinal cord, eyes, lens near the tumor. So all that is drawn on the CT scan. So once that is drawn, it is given for planning. So the medical physicist, so he will, or he or she will plan the treatment of radiation. So whichever beams, which is by which technique, what dose, how much dose the surrounding tissues are getting, how much dose the tumor is getting, is the tumor getting enough dose, or is the surrounding areas getting higher dose. So all this will be planned and shown to the radiation oncologist. Now, before starting treatment itself, we are able to see, okay, this area is getting this many dose. So if we are not happy with that, suppose say some area is getting a higher dose, spinal cord or heart or lens, they are getting a higher dose. So the radiation oncologist tell the physicist that, okay, this is not acceptable, we have to redo it. So again, the physicist or the person who plans again redoes it till a point that all the radiation doses to the healthy tissues and the surrounding tissues are met within the standard guidelines. Only after that the patient is started on radiation. So not only once the patient is started, also the follow up is done whether he has any side effects. So if we feel that there is some excessive side effects, we go back, and if necessary we do a repeat CT scan also, or we do a replanning also. So in these modalities, by doing all these, we are able to save the healthy tissues or critical structures surrounding the tumor to a very large extent. 100% definitely we may not be able to avoid, but every organ, every structure in the human body has a tolerance. So some amount of radiation, small amount of radiation will not cause any harm to the tissue. So these are the main modalities how which we try to avoid the maximum dose to the surrounding tissues, but at the same time give highest dose to the tumor.